My family is originally from South America, in Peru. And my father's a surgeon. He was the first in his family to become a physician. And growing up, when we moved to the United States, I really sort of got to see what an impact he had. When I was in middle school playing football, somebody on the varsity team that we were watching from my school collapsed on the field. And my father ran out and administered sort of the initial care on the field before the EMTs could show up. I'm Daniel Hashimoto. I'm a GI surgeon at Penn Medicine. When I was in college, I was volunteering at a hospital that was trialing its first virtual reality surgical simulator, a video game for surgery. This was over 20 years ago, and I was blown away. I thought, wow, this is very cool. I should really check out GI surgery. And that's really what got me hooked, video games. I take care of a range of conditions, but primarily I focus in diseases of the esophagus and the stomach. In particular, I'm very passionate about helping patients who are dealing with gastroesophageal reflux disease and thinking about whether surgical or endoscopic options might be of benefit to them in terms of improving their quality of life and potentially also reducing their risk of developing certain types of cancers. I also see a lot of patients who have a condition called a paraesophageal hernia. It's when the stomach actually slips upwards into the chest, and I offer an operation to restore the normal anatomy. I also see patients with a condition called achalasia. It's where the esophagus doesn't relax, and it makes it very difficult for patients to eat. That condition in particular, while rare, I'm very passionate about treating, because one of the things I was trained to do was to offer repairs for that, not just surgically, but also endoscopically, where we can repair that by just using a camera going down the mouth and no incisions on the body. I think what I love most about my job is, one, getting to know patients, and then two, establishing that relationship with them over time, to seeing them how they are before they had their surgery, how they're doing during surgery when they're in the hospital, and the really best part is seeing how they're doing after the surgery, when they're making improvements and getting back to the quality of life that they want and looked for. Every time that a patient walks through the door feeling good, it's like I'm watching my son take his steps for the first time. And so it's that level of sort of heartwarming feeling that I get.